I have two of the greatest kids anyone could ever have. My daughter, she's more than my daughter, she's my best friend. She has a 6-year-old boy, Harry, who wants to be a baseball star. He's a good kid. A little on the spoiled side, but Grandpa had a lot to do with that.
John Robinson lives alone in Bel Air, Maryland, about 30 miles north of Baltimore. He spent most of his working life in the billing office of hospitals and universities. He is 70 years old and manages diabetes, high blood pressure, and asthma.
I make about $24,000 a year, and better than $8,000 of that goes to medical expenses, which don't leave much leeway.
Each year, John worries about when he will fall into the Medicare donut hole, a gap in coverage of prescription drugs that has seniors paying for medicine out of pocket for months at a time.
Last year it went down. I didn't fall into catastrophic until I think September. This year is the earliest I've ever fallen into the donut hole. Last week of March, I called my doctor's office and I said, "You wouldn't have any samples of insulin laying around there, why?" They said, "You're not in the donut hole already." I said, "Yes, I am. Feet first." And so the next $4,500 is out of my pocket. When you're in a donut hole, what do? Do you take your medicine and put it on a credit card, or do you buy food to eat and survive?
Under the Patient Protection and Affordable Care Act, the donut hole will eventually close completely so that seniors can afford all their prescriptions. In the meantime, the law provides seniors like John a 50% discount on brand-name drugs when they fall into the coverage gap. Like millions of other seniors who found themselves in that gap last year, John also received a $250 rebate check from Medicare.
It's very helpful. I mean, let's face it, it would be another charge on the credit card if I had to pay it. I don't know what I'd do without my credit cards. It's gotten to that point. I could sell this place, but then what do? Elderly people should not be dependent on making decisions about, well, do I take this drug this time, or do I take another one? If a doctor says the patient needs these drugs, then the patient should have access to those drugs. And there's got to be a way financially that it can be done.
John believes the healthcare system is in need of serious repair, and that the reform law is a step in the right direction for seniors and others.
Well, the whole healthcare initiative, I feel, was necessary because there's so many things wrong with healthcare in this country. I said it when I worked in hospitals because I saw what people had to deal with every day. So many misunderstandings. There are a lot of people in this country that have no care and no access to it. That's wrong.